In 1984, the Canadian Health Care Act was passed, with an objective to protect, promote, and restore the physical and mental well-being of residents of Canada and to facilitate reasonable access to health services without financial or other barriers. Now, 29 years later, this objective is still proven to be true. The Canadian Health Care Act has evolved to creating one of the most inclusive healthcare systems. It is also extremely cost efficient when comparing to other countries, and also has one of the highest life expectancies compared to other countries. In Canada, the healthcare system is universal, meaning that it is fully inclusive and all citizens have equal opportunity to access health services. This is regardless of any personal or financial barriers. This means that Canadians can receive quick treatment and be taken care of in preventative and emergency situations with no need to pay directly to facilities. The healthcare system is also extremely cost efficient. In Canada, it's a province-wide contribution that comes together to create 100% coverage for all Canadian citizens, whereas in the United States, individually, each citizen pays directly for their own healthcare. Some comparison of numbers. In Canada, we are taxed 11.4% of our product, which results in 100% coverage for Canadian citizens. Whereas in the United States, they're being taxed 17.4%, which equals 85% coverage. Quite a big gap, but we're still receiving 100% coverage. Of this profit made for the healthcare system through product taxes, a certain amount of it is budgeted towards healthcare administration. In Canada, 16.7% of the healthcare budget is spent on healthcare administration, whereas in the United States, 31% of their budget is toward healthcare administration. So a recap on that, 17.4% gross domestic product, 85% coverage. Of that money, 31% of that goes towards administration, compared to only 11.4% tax, 100% coverage, and only 16.4% of that going towards administration, leaving the rest open to treatment and to other medical needs. In Canada, there's also one of the highest life expectancies. In the past 30 years, Canadian life expectancy has steadily increased. And remember, the Canadian Health Care Act was passed now 29 years ago, meaning there's a direct link between the two and why Canadians are now living longer and healthier lives. These life expectancy rates are a direct result of the Canadian citizens' well-being, meaning that in the past 29 to 30 years since this act has been passed, it has effectively treated and taken care of the well-being of Canadian citizens while doing this without denying anybody access. This is huge, and this is unlike any other country. Canadians are extremely lucky to enjoy a fully inclusive, cost-efficient, and living in a country that has such a high and steadily increasing health rate and life expectancy. Canada's healthcare system does take care of the